Melanoma Monday around here. It's a day to bring awareness to the deadliest form of skin cancer that more than 1 million Americans are living with. So, who better than board-certified dermatologist Dr. Rita Linkner to join us with what we need to know. Doctor, it's great to see you.
Thank you for having me.
Thank you for being here with us today and making us smarter, protecting us. And early detection in this case is key. What do we need to know about screening for melanoma?
It's a great question. So about 100,000 Americans get diagnosed with an invasive melanoma yearly, and the average age is 65, but for young women in their 30s and 40s, it is very prevalent as well. So let's go through today on Melanoma Monday the ABCDEs of what to look for when you're doing at-home self-checks, which I like to recommend doing about once a month. You can get a partner to help you or get a mirror to look at hard-to-look areas, but let's start with A. A stands for asymmetry. So ideally, if you look at a mole on your skin, you're gonna wanna see it be a perfect kind of circle.
Okay.
A is asymmetry, so it should be a mirror image of itself when you cut it in half. B is border. It should be one even circle. If it's ragged, scalloped, that's considered irregular. C is the color. Usually browns, tans are fine, but if you see a red, white, or even a blue, it's reason for concern. D is diameter. Anything smaller than a pencil eraser, not very worrisome. And then E is evolving. Is it changing? Is it itching? Is it bleeding? These are all things you should be worried about and then bring to your dermatologist's attention.
Do you need that little doohickey to do all of the ABCDEs, or is that helpful?
If you see something worrisome and you come into the dermatologist's office, we're going to do a full body skin cancer check, and I'm going to use my dermatoscope.
Okay.
And for instance, to look at a mole, this gives me like a good 10x magnifier on the actual mole, which is really nice to be able to see.
Does this one look okay?
That one looks perfectly fine.
Can you buy that at the drugstore?
Yeah.
You know I do.
I feel like that'd be good to have in the arsenal.
You need to be trained, and this is what we do as dermatologists, full body skin cancer
All
checks.
these doctors like barriers to entry. Yeah.
We're going to get you undressed head to toe. We're going to look in your scalp, in between your toes, inside your mouth. Make sure you have no nail polish on as well, because we like to look at the nails really clearly too.
Okay. So if you see something that looks a little off, what should you do?
Definitely bring it to your dermatologist's attention, and they're going to bring you in. If they think it's worrisome, they'll take a picture of it just so that we have it in our chart, and most likely you're going to have a little shaved biopsy done on it so that the pathologist can look at the specimen under the microscope and give us a much better idea pathologically of what's going on.
Real quick, the importance of sunscreen.
Sunscreen. So three things.
And the types.
And the types. Let's talk about the three things you should label read for. Make sure it's broad spectrum, so you know it covers UVA and UVB light. Look for an SPF 30, and if you're fair or have a family history of skin cancer, you might want to go up to a 50. And then water resistance, ideally about 80 minutes on that water resistance label.
Okay. DeMarco's headed to medical school.
You know, tomorrow.